Sally, when you want me to.
Yes. Yeah. Do you
Uh,
want to have a
yeah,
practice?
check if it's working. All right. So
Yeah.
let me know when to start, of course.
When Kiara gives me the thumbs up. Okay, so we've got the thumbs up. I need to introduce you, Sam. Hold on. So everybody, we have Dr. Sam White here. So Sam was a conventional GP, and he was in fact a partner in a GP's practice until 2.5 years ago, when everything changed for him. And he is now, well, he calls Dr. Sarah Myhill Yoda. And I think Sarah's been coaching you, hasn't she?
She's an incredible
Sam.
inspiration to everyone, and especially me. And you'll probably see a lot of overlap when I talk about case studies based on Dr. Sarah Myhill's experience over many years. And yeah, I affectionately refer to her as Yoda. There's no pressure, obviously, for me coming on after Yoda, of course. Yeah, hi Sarah. And I'd also like to personally thank Sarah for her support in terms of medical wisdom, but also in dealing with the demonic entities at the General Medical Council. So I resigned my position in protest at what was happening under the auspice of the Coronavirus Act in 2020. I would consider myself a libertarian in terms of sort of Van Mises, the Austrian School of Economics, and none of it felt right to me. The final nail in the coffin for me as an allopathic doctor was the introduction of an injection, which before it had been introduced, we had every reason to suspect would be harmful. And many people would have seen today, for instance, that they've withdrawn the use of the Pfizer vaccine, certainly in pregnant women, breastfeeding women. And of course, we knew that was, dangerous. We knew they hadn't done reproductive toxicology studies. And yet, for me, every aspect of or every 10 tenets of the Nuremberg Code had been breached just because the WHO announced pandemic. So I didn't want it to be in my name. I'd written to the General Medical Council, I'd written to the NHS, they took no notice. It was only when I went public, I caused quite a storm and was phoned up to tell me how crazy I was and suspended by emergency order. And then they put a gagging order on me, essentially, because they were so threatened and afraid of what I had to say, which was all based in scientific and medical fact. So I felt it was important that we took these people who have no interest whatsoever in medical ethics, medical law, the Nuremberg Code, to the High Court. And I won in December 21 based on freedom of speech. And I wanted to do that to enable other doctors to feel less afraid of speaking out.
Well, I think everyone is just so grateful for that. I think we, Sam, have admitted everybody who's sort of bought a ticket this morning. So I'm really, really looking forward to hearing your talk. And we've got the first slide up now. You probably have introduced yourself perfectly. I'm going to put myself on mute now. And okay. I'll see you in 40 minutes.
Okay, let me know on time, Sally, because I might talk a bit too much. I'll try not to. So I've been given special dispensation to go off topic a little bit. And prior to talking about medicine, I want to talk a little bit about who we are, who we should be, and how what's happened to us in the last 3 years has perhaps stimulated a mass awakening about how much of what we've been told throughout our lives has been based on deceit. This past 2-3 years will in time be considered the greatest deception, simply because of the numbers of people affected worldwide. And I echo the sentiments of Dr. Rainer Fulmich and more recently Christian Andersen, who's a German MEP, that these will be considered the greatest crimes against humanity ever. But many of us might have grown up looking on, perhaps wondering why governments acted and behaved in certain ways. Why, for instance, our brightest and best needed to be sent out to fight illegal neocon wars. Where was the money coming from when we've got people at home in our own countries without food, water, or shelter? And yet they do it anyway. There's no repercussion. They don't go to prison. And in fact, they're awarded the highest honors within the establishment quite often. So I've chosen this quote from Genesis, not because I'm necessarily a big Bible thumper myself, and I don't subscribe to monotheism as such. I personally say that I do believe in a higher consciousness and God. Whatever your beliefs, whatever your religion, my personal take is that this is who we were meant to be. We were meant to have dominion over the earth. We are incredible humans with an unlimited, infinite ability to create. And yet over the years, over the centuries, thousands of years even, that's gradually been stolen from us. And I want to look at a few key points in history about how that's happened. Because when we think about healthcare for the future, we want a system, and I think Dr. Myhill and myself will show to you how we get patients better without big pharma. We want a system, albeit we've got one now that's free at the point of use. We want a system we can pay for, but isn't hand in glove with big pharma. And you need to think then, well, one of the leading causes of death in the West is iatrogenic, so doctor caused, either by a medication or a surgical procedure. So we have a system, albeit free at the point of use, but it's not really, but it doesn't serve us, and certainly the people who run it don't. They've certainly never replied to any of my public interest letters revealing, the scientific basis for why I and others would be concerned about all that's happened in the last couple of years. So I'm going to go back through history, and really this all began in the 1300s with a papal bull that gave Rome the dominion over our souls. And then, of course, in the 1920s, we had the Wall Street crash. And finally, in the US, in particular, the confiscation of money of substance. So in the US Constitution, you'll find that the money should be gold and silver. Nowadays, it's not, and it's not really anywhere. It's what's called fiat currency. So it's not backed by anything. So when, for instance, governments want to buy billions and billions in vaccines or waste billions on PPE, the central bank, the privately owned central bank, can print money almost into oblivion. And that devalues currency. So whilst it may seem great, over the last 2 decades that house prices have gone up, if you happen to own more than one house, what's happened in reality is that the value of currency has gone down, and therefore its purchasing power has gone down. So in 1933, Roosevelt ordered that all gold and gold certificates had to be surrendered to the federal government. Prior to that, your American dollars could be traded in at a bank for deliverable gold. So what we had was money being replaced, which was backed by substance, and therefore could not be printed into infinity, replaced with money of form. Now, if you look at the very bottom of the slide here, bear in mind, that people who didn't follow this order were faced with hefty fines, and we're talking $10,000 fines at the time, or imprisonment. Okay, so it was a very threatening order. Now, right at the bottom, what we've got is, within the context of HJR 192, which was signed into effect rather almost secretly in terms of this aspect of it, was that all people could issue security futures and discharge their debts. So that means you can get rid of your debts. The problem was they didn't tell you how to do it. And they didn't even tell you that you could. So we go on to the next slide. So we can think of the world as being one big giant corporation. And within it, we have countries which are actually just corporate entities. So the United Kingdom, Australia, Canada, they're all corporations, and they all operate in a system of bankruptcy. So in 1933, you had the completion of the bankruptcy of nations. Now, when you're bankrupt, a bit like if the bank comes to repossess your home because you haven't kept up with interest, payments, it's the creditors who get paid first. So what I'm trying to say here is it's the creditors that make the rules. So if, for instance, you were wondering why the government you elected locked you down when you were perfectly well, the government is beholden to the creditors, since they operate within Chapter 11 bankruptcy. And a lot of this leads back again as it comes to the Vatican. The VAT is the holder of all. The holder of all souls, as we got in the 1300s with Pope Boniface. So the other thing to understand is that there's basically two yous. Without knowing it, our mothers registered us as property of the state via the birth certificate. And many of you may have looked at this, and that's why I refer to what's happened now as the cabal kind of overplaying their hand, such that people have had to go down the rabbit hole and find out some other truths, some other deceptions. So there's two versions of each of us. There's the living, sentient human being with this unlimited ability to create. And then this corporate entity, which involves a fictional identity via our last name. Okay. So under that, as the straw man, we're within this trust that's created. We are the debtor. We are the straw man. Okay. When you've paid off your mortgage, you don't own your home. The land registry does. You can merely own title on it. And it's the same with your car. It's the DVLA who owns it. When you register, you relinquish control. Okay. And there's all these various tricks and guises that they used. But I want you to keep in mind these kind of things when you consider what they were able to get away with, seemingly got away with it so far in the last couple of years. Because what the government did, a belligerent government did, is instead of attacking people overseas, they attacked their own people this time. Now, this is a really revealing interview. On the right, you've got David Buick, who is a 50-year city veteran. In the entirety of the interview, he's talking about the wondrous reforms that happened in the wake of the 2008 financial crisis and how the City of London is much different now. I should say that you're probably aware the City of London is not a part of England. It's its own separate principality, much like the Vatican and Washington. In the middle is the interviewer, and you can watch his face as he listens to the person on the left, Professor Richard Werner. Professor Werner is an economist and wrote a 15-year empirical study on the 5,000 years history of banking. And it's called The Three Theories of Money, and it's well worth watching. So have a listen to what he says about what banks do. Hopefully my internet connection will work. Right.
Richard, when you think about inequality in the UK, and it's a hot topic, and you think about, as you'd like the banking sector to be decentralized, flatter structure, more resilient, how do you begin to talk to the public or the political class about achieving those goals?
Essentially, you know, if we want to produce something, we need funding. So there's a role for banks in almost everything that's happening in the economy. But what exactly is that role? I'd like to reflect on that. Banks are being thought of as intermediaries, but this is not really what's happening. Banks,
what are they then?
the creators of the money supply.
So you're firmly of the view that banks create money out of thin air?
Yes, well, I produced the first empirical studies to prove that in the 5,000-year history of banking. Banks are thought of as deposit-taking institutions that lend money. The legal reality is banks don't take deposits and banks don't lend money. So what is a deposit? A deposit is not actually a deposit. It's not a bailment. It's not held in custody. At law, the word deposit is meaningless. The law courts and various judgments have made it very clear, if you give your money to a bank, even though it's called a deposit, this money is simply a loan to the bank.
That's true. Yeah.
So there is no such thing as deposit.
So you
There's
think
just
it's poorly and
loans
it's
to the bank.
adequately named then?
So banks borrow from the public. Okay, so that much we've established. What about lending? Surely they're lending money. No, they don't. Banks don't lend money. Banks, again, at law, it's very clear, they're in the business of purchasing securities. That's it. So you say, okay, don't, confuse me with all that legalese.
No.
I want a loan. I want a loan.
Yeah.
Fine. Here's the loan contract. Here's the offer letter, and you sign. At law, it's very clear. You have issued a security, namely a promissory note, and the bank is going to purchase that. That's what's happening at
Put
law.
it in layman's terms. What does that mean?
It means that what the bank is doing is very different from what it presents to the public that it's doing. How does this fit together? So you say, fine, the bank purchases my promissory note, but how do I get my money? I want, it's a loan. I want my money.
$200,000,
I
right?
don't care about the details. I want the money. The bank will say, well, you'll find it in your account with us. That would be technically correct. If they say, we'll transfer it to your account, that's wrong, because no money is transferred at all.
It's already in
From
the bank.
anywhere inside the bank or outside the bank. Why? Because what we call a deposit is simply the bank's record of its debt to the public. Now, it also owes you money, and its record of the money it owes you is what you think you're getting as money. And that's all it is. And that is how the banks create the money supply. The money supply consists to 97% of bank deposits. And these are created out of nothing by banks when they lend, because they invent fictitious customer deposits. Why? They simply restate, slightly incorrectly in accounting terms, what is an accounts payable liability arising from the loan contract having purchased your promissory note as a customer deposit, but nobody has deposited any money. I wonder how the FCA deals with this, because in the financial sector, you're supposed to not mislead your customers.
So the FCA, in case you were wondering, is basically paid for by the banks. So that's how they deal with it. So what he's saying there is, if, for instance, you go for a mortgage, you sign the paperwork, it's you who's created the promissory note, it's you who's created the money. The bank merely has a license to convert that into money that's spendable. Okay, so when he says they're 97%, 97% of the money in circulation is created by us, the living, breathing human. So the birth certificate is really a foreign situs trust. It's global, and we're, instead of being this person on the left, the creditor, we're stuck here as the straw man. So as the debtor, we can be forced to pay back debts for which no money has ever been lent to us. So think of all the people, in history since the 30s who have lost their home because they couldn't afford the repayment or the interest. And if you're a bailiff, I'd strongly advise that you take a trip to the careers officer and think about a change of career. There are ways to access this trust, and I started to learn about this a few years ago when I entered my birth certificate number onto a bond site, and I found it came up. And that was great. I thought I just didn't know how to do anything with it. But there are people who I'm working with, and we're looking at how we can then create a health service that is paid for with us as the creditors. So, for instance, people can come to us for functional medicine. We wouldn't need paying because we would be able to create our own money to buy a house and buy a car and things. But we might need to pay for laboratory fees, for instance, for people. We might need to buy premises to treat people as inpatients, okay? And therefore, we have a health service that's beholden to big pharma, but we don't need to be. So this is a project that's ongoing for me with a few select others. If you'd like any information on this rabbit hole, then I've put my email, my secretary's email on here, and I can point you in the right direction for a library of information if you'd like to learn more. As promised, I suppose I should probably talk about some medicine now. So I've been getting into functional medicine and studying it for a number of years prior to my resignation, principally because I had hit a brick wall with my own health. I became ill with ME, chronic fatigue, and that's how I first got chatting to Sarah, because I was reading her books. And typically, I would say that the patients who come to me are those with what in the allopathic system would be considered those with diagnostic uncertainty, and they have literally been passed over the years, sometimes decades, from pillar to post, having every different type of investigation possible. That's very common. We don't think about patients in terms of the symptoms. It's not a tick box approach like it was for me in primary care. It's about the whole person. It's about all of the systems of that person fitting together, how they overlap. And there are real reasons why allopathic medicine has had to become very subspecialized, i.e. you're going to see a heart doctor, but then he'll say it's not your heart, it's your lungs. So you're going to see a lung specialist, and then he'll say, oh, and it's your stomach, you need to go and see. And that's how these people get passed around. So we don't do that. And we ask different questions. And usually people come to me and they say, you know, I've had all these tests, there's nothing wrong, my bloods are normal. And I don't mean it in an arrogant way, but I simply say, we'll find out what's wrong with you, okay? And I haven't had one patient where I haven't been able to treat that. And the patients that we're going to go through, who've got better, you know, like so many others we've been seeing, I never would have seen this as a primary care physician. It just wouldn't have been possible. It wouldn't have been possible to ask the questions. I didn't have the time. But, you know, we go all the way back to birth. You know, how was the baby born? Did they get their first inoculation of their microbiome through passage through the vaginal canal? All those things, okay? Anyway, patient one, this was, you know, what I thought would be quite a challenging case for me, but the boy's mother was incredibly dedicated to him getting better. So he was 20 years old, normal delivery, breastfed for 14 months, and then it started to become obvious that he wasn't hitting his key milestones. And mum actually said to me, welcome to the vaccine trail that I've been on for 20 years. You know, knowing full well how her son had potentially been harmed. And that's, you know, as Dr. Myhill was alluding to before. So we had, by the age of 7, we had diagnosis of global development delay, learning difficulties, epilepsy, and severe autism. He was wearing ear defenders. When he first came to see me, he'd just been expelled from school because they couldn't manage his behavior. Up until aged 18, his epilepsy had been relatively well controlled. And then it was around the time of lockdown, it started becoming very severe and having frequent seizures. So he was having sometimes 3 a week. So his neurologist had increased his lamotrigine, which is an anti-epileptic, and then also added in zonisamide, which had given him some sort of control. So we went back to basics, and hopefully this is music to Yoda's ears. So he was on a high carb diet. He was on growth promoters, dairy. He had what we would define as metabolic syndrome. So we switched him over to paleo ketogenic diet, prior to which mum wasn't having much sleep because he was getting up in the night to raid the fridge because his blood sugars were dropping. He was getting what we call reactive hypoglycemia. His cortisol would have been all over the place, and he was having to get up in the night to feed his hangry episodes. Okay, so I just want to talk a little bit, show this video now about the gut-brain connection and why it's so important.
How the gut and the brain communicate has fascinated us for centuries. The gut-brain axis transforms information via the vagus nerve from food to feelings. Once eaten, digested food particles enter the small intestine, which is covered with a velvety layer of villi. Each villus is lined with a single layer of epithelium. This layer is made up of different cell types. One of them, the enteroendocrine cell, is unlike the others. It is our gut sensor. In addition to communicating through hormones, we discovered that enteroendocrine cells also synapse with nerves, including the vagus nerve. We call those enteroendocrine cells synapsing with nerves neuropod cells. They sense and react to their environment. They sense mechanical, thermal, and chemical stimuli, such as nutrients or bacterial byproducts in the gut lumen. Inside neuropod cells, signals from stimuli are converted into tiny electrical pulses. These pulses propagate via synapses onto the afferent neuron of the vagus nerve. Vagal neurons carry the sensory information to the brainstem, linking the signals generated inside the small intestine to the brain. The neuropod cell connection with the vagus nerve serves as a conduit for food in the gut to influence brain function within seconds. This connection is also a potential portal for gut pathogens to access the brain. This new knowledge is a foundation for designing therapies to treat disorders related to altered gut-brain signaling.
So it was very obvious to me that he had this altered gut-brain signaling. Okay, so we have what's called glial cells in our brains, which are the immune system of the brain. They were clearly being activated, and almost certainly by what was going on in his stomach. Okay, so he was on a high carb diet. He would have had a fermenting upper gut. When we did his stool profile, we found dysbiosis. So his gut microbiome was all over the place, as was his metabolites of the gut microbiome. So 70% of our immune system comes from having a healthy microbiome. And for instance, he was very low in something called butyrate. And butyrate, I think of as being like a conductor of an orchestra. We have this wondrous innate immune system, which we're born with, which can be somewhat sabotaged by vaccines. And then we go on to develop an adaptive immune response. Butyrate, via something called interleukin-10, synchronizes the innate and the adaptive response. And his was all over the place. He was also low in some very key vitamins, so magnesium, B6, B12. So his mitochondrial function, or rather dysfunction, that was going on in the gut as a result of pathogenic activity and dysbiosis was being relayed to his brain. His brain was inflamed, and therefore this was manifesting the symptoms of having tonic-clonic, severe recurrent epileptic seizures. Okay, so when I went on to do some follow-up testing, he had normal organic acids, so he wasn't breaking down his neurotransmitters or his amino acids, so that was good. And just here, you'll see that he had normal kynuric and quinaloic acid. Okay, so kynurate is very protective of the brain. Quinaloic acid is damaging, it's neurotoxic. If I'd have done that test to begin with, that would have been abnormal, that would have been skewed. So around 6 months later, after initially seeing him, he'd lost 2 stone in weight. He was seizure-free. He was off lamotrigine. And mum was slowly reducing his zonisamide. So he was on 2 anti-epileptics. He had already had a personal trainer, and they would go for walks once a week. But he was struggling to do that 6 months prior. His heart and his lungs just couldn't keep up because of the global mitochondrial dysfunction and the metabolic syndrome of being very overweight. But his personal trainer said he looks like a new man. Okay, yet all we did was the basics for him. We changed his diet and nutrition. We stopped him being poisoned by carbs, which can leach out other key vitamins and minerals. And we improved his detoxification pathways. Speaking of which, he hated the taste of glutathione, which you would have heard Sarah mention is one of our most potent antioxidants. But thankfully, that came as a patch. So he uses the patches instead, and he's much happier with those. Okay. Patient 2, very familiar picture that we see. It's a 34-year-old woman with CFS-ME, which is really just this umbrella term for profound fatigue, unrefreshing sleep, post-exertional malaise. And the exertion might only be very minimal. When she was younger, she suffered with recurrent urinary infections and even had an admission to hospital with urinary sepsis. She had the usual Western American diet, so high carbohydrate, and there was the pressure to be doing that because of high carbs. So we did a dietary 180 for her. And also I sent some bloods off to Germany, where there's a very reliable laboratory there. Can we silence that part? Sorry. Thank you. And it's very good for tick-borne disease or vector-borne disease, being one of sort of 2 in the world, which is very good. You'd be surprised how many people in this country test positive for Lyme disease without ever having noticed a tick bite or a rash or being unwell. And yet she had incredibly high antibodies to a respiratory infection called mycoplasma, which is a lung infection which typically affects young women. I've seen it happen quite a bit in pregnancy in women, and it doesn't respond well to the first line conventional course of antibiotics. And she was still expressing these high levels of antibodies. What was key, however, was that her natural killer cells, and these should be about 150 to 400 usually, were pretty wiped out. The reason being is that they were being consumed and being occupied by dealing with infection. Okay, her GP results, all I had really were normal, but we'll come on to the thyroid in a sec. But often the only hormone I get back from the GP is the thyroid stimulating hormone. So for me, that TSH is not normal, and definitely not until I know the other values of the thyroid function. She had an amazing response, thank you, Sarah, to the PK diet. within a couple of weeks. And so already her energy delivery mechanisms had changed. She had improved cognition, and she felt a lot better. When I redid her bloods, all of the markers had gone down, but also her CD57 count had gone up to over 200. She'd gone back to just joined a gym and had started swimming. And Sarah talked about how we need to pace people back when they're getting over chronic fatigue, CFS. So sometimes when people get better a bit too quickly, you do have to hold them back a little bit and say, we don't want you going into anaerobic kind of respiration, lactic acid production, and destroying the mitochondria, which at that stage is still quite delicate. Okay. My next patient is another CFS patient, and he recalled having an acute illness at around age 21. And he had a 23-year history of having had CFS-ME. And he because he was over the kind of the acute phase, if you like, in terms of psychological dealing with it. He was self-employed, and he just changed his lifestyle to be able to manage it. And he had gone through a phase of being absolutely bedridden. Remarkably, he'd already seen from my website that I was an advocate of the PK diet and had read Dr. Myhill's book on that, and said to me that he was enjoying it, which I don't often hear. Usually my first consultations are talking about the massive dietary 180 we need to do, and then it becomes a bit of a haggling process to convince them that we really do need to go down this route. Okay, so the last lady's CD57 count was in the 80s. This chap was 48. He was really quite wiped out, and that points to chronic bacterial infection, and he had a low CD3 count, so there was some viruses going on just by looking at that. We also did his salivary cortisol, and if you look at where the green band is, that's generally where we want to be. He's nowhere near that. Okay, his body is stressed, and we'll go through that shortly. But also the protective hormone DHEA is very low, so he's high in cortisol, and the hormone to protect him against the harmful effects of very high cortisol is correspondingly low. So that's a bad combination. Okay, so this is one of the hormone synthesis charts. It also tells you, I'm sure you can guess why, or one of the reasons why I don't like statins. Okay, so in order to make these hormones, we need cholesterol. Okay, we need cholesterol. What happens when we're chronically stressed? In the case of this young man, I'm saying young, he's the same age as me. What happens is he's under a lot of stress from bacterial and viral pathogens. His body, his physical body, does not know the difference between that kind of stress and the stress of being suddenly chased 2,000 years ago by a saber-toothed tiger. Okay, it's the same hormonal response. And so what the body does is it shunts all of the production of hormones into cortisol instead. So men and women would end up low in DHEA, which would protect and offset the high cortisol. This is a protective mechanism. Your body's trying to help you, but if prolonged, it ends up causing problems. And often men will have low testosterone, which you need to address. Okay, so after cholesterol, we get pregnenolone, which is why, as Dr. Myhill mentioned, we will use pregnenolone as a precursor hormone to try and rebuild these other hormones along with DHEA. And then I sometimes use something to boost testosterone as well, which just so happens to be good at treating parasites, which is what he had. So when we're under stress, adrenals increase their output of cortisol and DHEA, and this boosts energy. But if chronic, the adrenals can't keep up with demand, and DHEA falls right off. And then if you've got an excess of adrenaline, we measure that on what's called a Dutch test. You get things like insomnia, CFS-ME, depression, irritability, digestion difficulties. Okay, so you're in a fight or flight response. Your energy is being, directed elsewhere. It's not going to your gut. So you don't have the digestive enzymes, and your blood sugars can become erratic as well. If prolonged, high cortisol is going to give you reduced immune function. He was overwhelmed with viruses and infections, increased dyslipidemia, so too high cholesterol, and reduced sensitivity to the effects of insulin, resulting in sort of type 2 diabetes. And obviously, we can't produce DHEA. What is the benefit of cortisol then? Well, it converts proteins into energy by making available amino acids. Amino acids are the building blocks to protein. It stimulates the liver to convert amino acids to glucose, maintains our blood pressure, helps counter inflammation and allergies, and it helps in acute stress responses. So we do need it if we ever do need to run away from a saber-toothed tiger. I am in Africa, so it could happen, I suppose. DHEA, okay, this is very protective. It's also a precursor to testosterone and estrogen. Okay, it improves our resilience to viruses, bacteria, parasites. He had bacteria, viruses, and parasites all going on. Prevents osteoporosis and decreases, abdominal obesity in men, and increases muscle mass. So we don't want to be losing that. Basic restoration would be, he was PK adapted already, avoiding refined food, alcohol, ginseng, licorice, they're all very good for supporting the adrenals along with other things. Make sure that he's resting properly. And then we were giving him pregnenolone balanced throughout the day under the tongue, along with DHEA. Okay, and also some natural adrenal gland extract. I also gave him some Tonkat Ali, because that deals or helps deal with blastocysts. There was some work done in Asia to reveal that. Blastocyst being a common finding of a parasite, even in the UK, and it boosts testosterone levels as well. So I've included this overly complex diagram just to point out the relationship really between the adrenals and the thyroid. And you recall me saying that I'll try and get patients to get their thyroid tests done at their GP, because then they don't have to pay for them. But often all that comes back is the thyroid stimulating hormone. It's not telling me about the output from the thyroid gland itself. And they never do this test, which is the reverse T3, to see if a patient could convert their T4, which is in pharmaceutical terms is levothyroxine, into the active form. Okay, and then this is going to feed back as a result of stress and affect the adrenals as well eventually. Okay, so usually we do, if one test is out, there's a need to do the other, I think. This is one of my favorite cases actually, because this is a 28-year-old lady who'd had rheumatoid arthritis since 16. When I first saw her, she wasn't able to work. She couldn't use her hands, and she was doing administrative work. And some of her first words to me were, "I just want to go traveling and spend some time with my boyfriend and get married." Okay, and yet, what had happened was she'd been on a drug which is very immunotoxic called methotrexate once weekly, but even that wasn't managing her symptoms. So she'd been switched to a biological agent called Imraldi, but she wasn't able to tolerate it. She wasn't getting follow-up because of lockdowns and all that. Prior to her flare, I will say that she'd had 2 of the mRNA vaccinations, and the standard advice by the rheumatology clinic was we advise all our patients justifying it as them being immunosuppressed to get vaccinated. Okay, and when one of my first objections to the introduction of an mRNA based injection was that it was, as I saw it, the very definition of autoimmune disease. So why then would you make it even worse in someone who's already got a pre-existing autoimmune disease? It's absolute crazy. So we did a test, and she was positive for Lyme disease. These tests went to Germany. They pretty much, I'm pretty sure, would have been negative in the UK. The test in the UK is about 60 years old. You'll pick up about 30% of cases. She's a lady who doesn't recall ever having a tick bite or a bullseye rash. Most people don't. So we started her on treatment for that. We sorted out her gut because I knew that her microbiome was going to be all over the place given the gastrointestinal upset. And the last I heard from her was, please can Dr. Sam do me a letter for a mask exemption so I can go traveling with my boyfriend. Okay, and she'd gone back to methotrexate but reduced the dose right down, which is brilliant. Patient 5, wonderful lady, 50 years old. She had horrendous autoimmune history. So Crohn's colitis is, inflammatory bowel disease. Ankylosing spondylitis typically affects more men, but it's an inflammation disorder, autoimmune again, of the spine. She had pernicious anemia, she had issues with B12, and she was on sulfasalazine, azathioprine, both of these very immunosuppressive, particularly the azathioprine, which is why you need to have ongoing monitoring and bloods. And then, almost as bad, which one of my pet hates, is omeprazole, which is one to lower the acidity in the stomach. So she wasn't able to kill off any pathogens that would be going into her stomach because there was no acid there. Okay, and this also lowers your red cell magnesium, which you use. This is the first page of her stool profile. So she had dysbiosis, so her microbiome was all over the place, and she wasn't making much of her immune system. She wasn't making her butyrate, or short-chain fatty acids, because of this, and because of all the immune suppression. We also did a breath test for whether there was fermentation in the upper gut. And the hydrogen line came back completely flat. And that can sometimes happen when you have a hydrogen sulfide producing bacteria. That's a particularly nasty one and can stimulate a lot of histamine issues and allergy as well, and can affect the heart. So it's important to treat that. We got her off her use of acid suppression therapy. I'll often use zinc carnosine in replacement. That gives someone their zinc, which they need, and it can help initially with that transitory phase of coming off long-term acid suppression therapy. She previously had inpatient treatment with steroids as a young woman, so we obviously did her adrenals, basic vitamin package, sorted out her gut, the dysbiosis, and also rebalanced her adrenal gland function. I had a message from her literally 2 weeks ago to say, Sam, I'm doing really great, and I'm off all the toxic, well, I can't say that, begins with shit and ends in it. So she's doing really well. So there we go. This is Georgia, who I've got to know. And this is a small extract from a documentary film, which has been, hopefully will be released, but probably not mainstream. And I want you to just hear her story.
And my mum was standing on the drive. She'd been looking after the dogs while we'd been away. And she was talking to the neighbour. And I remember getting out of the car and I burst into tears and I said, please don't be alarmed at how I'm walking. And it was then I really realized, I think after the tremors on the Sunday, that there was something seriously wrong. And I'd been fine up until, like, I'd been healthy, perfectly fine up until the point of me having my second vaccine.
Breathe. Okay, come on.
It's really funny because I look at these videos and I watch them and I either get really emotional watching them or I just go, wow, look at how far I've come and look at where I was. I was on a Zimmer frame. I was in a wheelchair. I kind of feel like I'm looking at somebody else sometimes. And not me.
So you'll be pleased to know that last night I received a text from Georgia to say that she was on holiday in Israel, seeing family and swimming. Okay, so I'm going to talk about something that helped her and what I could potentially see as an adjunctive therapy in patients with post-vaccination syndrome. So this is her
Sam, just sorry to interrupt. So we've got 8 minutes.
Okay.
But I really want to hear about Georgia because she's such an important case study.
Yeah. Okay. So I'll just show you Georgia. I'll miss out Jenny because it's very similar. So this is her after.
Let's go. Walk to me. Keep it coming.
Okay. So she's gone on to have a few more. I'll skip out Jenny, but this, I spent a month with Professor Ulrich Schneider in Germany, and this is a treatment called gold-infused cytokines. And basically the process is that a patient has their blood taken in tubes which are patented, which have nanoparticles of gold in. Gold has long been known as an anti-inflammatory, but whilst previously working as a rheumatologist, he saw all the horrendous side effects of gold. This is then spun and stored overnight. And when it's spun, centrifuged, the reactive cells are taken out. So you're just left with the serum, which is then injected into the patient. I'll skip through this, Sally. And what it's basically doing is increasing levels of certain cytokines, one of which they found to be gelsolin, which are proteins that can help restore the body. So the functions of gelsolin would be to protect nerve cells, reduce oxidative stress, bind amyloid, reduce the chances of cancers becoming metastatic. And so you see these remarkable recoveries, but I want to emphasize that this would be in conjunction with a functional naturopathic approach. So I don't want any of these patients to just think that they could just have this and then be free of the burden of the side effects of the vaccine. We can't have them going back onto a toxic diet. We need to get their mitochondria working. And that's what I would just wanted to touch on just before we finish, in that why I think functional medicine can help in post-vaccination syndrome, just like it can in long COVID, which is basically ME anyway. So we know that the spike protein, which is the pathogenic component of the SARS-CoV-2 virus, binds to ACE2 receptors. Okay, so we're seeing people with multi-systemic disease. Young women tend to get neurological injury. Young men, I think because of high androgens, tend to get cardiac injury, pericarditis, inflammatory heart disease. But it can affect many systems. And we knew that because the Japanese did a biodistribution study showing that this thing goes everywhere, okay? If you were ever going to protect someone using a vaccine against a respiratory pathogen, you would not want it in the blood, okay? You would want it in their secretory immunoglobulin, which is in their respiratory airways and in their guts. If you put it into the blood, it's in the wrong place, okay? So there was, like I said, there was every reason to suspect it wouldn't work and it would be harmful. Okay, so we know that, for instance, the spike protein has a high affinity for these ACE2 receptors. Now, when you inject someone with these mRNA vaccines, I think it's naive to think that they just bind to the ACE2 receptors and then disappear after having made a few antibodies. What they're probably doing is not unbinding. The binding is persistent, and that's changing the polarity in the cells. So instead of being able to make oxygen, the cell shifts into inflammatory process. And we come back to mitochondria again. Mitochondria is literally the key to health. So the mitochondria no longer have oxygen, they can no longer work, and they can no longer do what's called oxidative phosphorylation. Okay, so they then become pro-inflammatory, and they create these inflammatory fatty acids which block the cell membrane. They trap the virus, and usually in a healthy person, what you would get is new cells developing, new mitochondria proliferation and developing. But with this continued production of spike protein, ACE2 receptor binding, we're stuck in this loophole. So we've got to get them out of this, okay? And we can do it with the right mitochondrial support, and also deal with the other issues that come about as a result of the T cell destruction, as identified by Dr. Ernie Burkhardt, that happens in these patients. So often we're seeing reactivation of latent viruses like Epstein-Barr. They have a lot of dysbiosis going on. So we want to restore the function of the ACE2 receptors, and you know, that could be in the brain, for instance. The brain consumes 30% of the oxygen. So if you've got damage to ACE2 receptors, you can get chest pain, palpitations. We're seeing that. If the lungs are affected, coughing, shortness of breath. If it's the pancreas, longer term, you're going to get diabetes. Okay, so we want to restore that, the ACE2 receptor deficiency, stop them being damaged. Okay, and also use mitochondrial support to stop the mitochondria being degraded and go back into a proliferation phase. Okay, so all of these kind of supplements and supports are for, you know, what's known as Krebs cycle, oxidative phosphorylation, and will be in the literally in the basic recommendation of Dr. Myhill's you know, books on how we rebuild mitochondria function. Okay. So I've done a little video there, but I'll leave that for another time. You'll get a copy of my slides, and I'm just going to show you this to end. It's my best testimonial. Okay. Okay.
Oh, that's so great. I love that. I love that. That was really, really great. Thank you, Sam, for that. Ask you one question or two questions. Firstly, are you registered with the Institute for Functional Medicine?
Yeah.
Yeah, you are. And what's the difference in feeling for you now practicing as a functional medicine doctor as opposed to a traditional GP?
I was bored, miserable, tired, and incredibly frustrated that no one ever got better. I couldn't help my patients, and yet it was zapping the life out of me. It was soul destroying what I was doing. Okay. And now, as Sarah describes, I have freedom. I'll speak up quite happily. I always have spoken my mind anyway. That's what got me into trouble in the first place. But I can say things frankly to people that they need to absolutely avoid. You know, I can ask questions, the right questions to get people better. That first lad with autism, I haven't even checked him for heavy metals yet, or mold, or mycotoxins. Yeah. But he's already doing so much better just with the basics. And even the basics don't get done in allopathic medicine. You know, how many people get asked about their diet, and then if they get diagnosed with diabetes, they're told to stop, you know, having fats. You know, if they get, you know, gallstones, they're told to stop having fats, go on a low fat diet. Low fat diet is invariably high carb. Okay. None of the environment is considered, and the environment is that creates problems for us is not just you know, what we live in at home. It's our psychological well-being. It's everything that comes together, and you could literally do none of it working as a tick box, points for prizes, which is how you're paid. And for anyone who's interested in that, I did an extended interview with Majid Nawaz recently, talking about how GP practices are paid. So I'm free.
Well, that's great to hear. We're going to take a half-hour break, everybody. And then Dr. Jane Donegan will be the next speaker. Jane has a similar journey into functional medicine and homeopathy as Sarah and Sam. And it's going to be very exciting hearing from her. So we'll see you all again in half an hour. Thanks very much. Thank you so much, Sam. And I'll see you in a second.
Yeah, we'll do. I'll pop round.